Hi, my name is Lydia, and I'm the producer of the upcoming Healthcare Payment and Revenue Integrity West Congress, a one-of-a-kind event uniting payers, providers, and technology developers in addressing challenges along the claims continuum. Today, I have the pleasure of interviewing CJ Wolf, the professor and assistant program director at Brigham Young University, Idaho, who'll be giving the talk, Reimbursement Red Flags for a Hospital Insider. Hi, CJ.
Hey, great to be here. Thanks for having me.
So my first question is, I feel like your talk is quite unique and different. Could you explain a little bit about what you're going to actually talk about during this talk?
Yeah, absolutely. So for years, I've worked inside hospital systems in compliance and revenue integrity and those sorts of things. And I've seen quite a few things over the years related to maybe a little overzealous type of performance of procedures, particularly the specific procedures we're going to talk about in this talk are dialysis patients. So dialysis patients are getting dialysis, 3 to 4 times a week. And so you need an access site, meaning you need a needle and you need a place where you can get a large volume of blood flow. And that usually is done in a fistula that's surgically created. And those fistulas can sometimes malfunction. And so it's common for those patients to need diagnostic imaging of those fistulas for diagnosing any problems, and then sometimes some therapeutic procedures. But what happens, I've seen in some cases, not in all cases, but in some cases, providers tend to do those procedures on a routine basis instead of when the patient actually is having problems with their dialysis. And it's really the latter when they should be done. And so sometimes what I've seen is hospitals just reporting those procedures more frequently than they should have been performed. Again, not in all cases, but we're going to talk about the scenarios where that may be true. And then the second area, we're going to talk about a bunch of different procedures, but another focus area will be peripheral vascular disease. And so this is, our arteries out in the arms and legs. And when those arteries can become clogged or blocked, patients have symptoms. And so there are usually therapeutic procedures that physicians and hospitals will employ to make those patients better. And sometimes those are done more frequently than they really should be, or they're done before other therapies have failed. So usually it's more appropriate to do some kind of more conservative therapy first, which is not the procedure. And then if things aren't working, then you move to the procedures. And so in both those cases I just described, sometimes the providers are doing too many of them. And so then that affects reimbursement, right? So then the hospitals are being inappropriately reimbursed in some scenarios.
That's really, really interesting, and I think it's going to be a great talk. And honestly, apart from all the things you had mentioned, looking out for those specific codes and specific treatments, is there anything that a payer on the other side could pick up on earlier to maybe investigate this or know to keep an eye out for this?
Yeah, I think there are. So, when payers know that certain patients in their plans have these conditions, right? So if a patient has dialysis, the payer is going to know that, right? They know that the patient's going to have end stage renal disease. If there can be some way of kind of monitoring those patients and checking the frequency of the procedures being done, and maybe looking from a data analytics standpoint, looking for, when there might be spikes or when things are outliers, when the amount of procedures or the volume of procedures are outliers. So I think that could be something to look at. And then on the peripheral vascular disease side, it's just really important. Again, if payers know that the patients have those conditions, do they have policies in place, first of all, to help providers understand that, look, you should be trying conservative therapy first before you jump to performing these more invasive procedures. And so it's just kind of managing those diseases and those conditions from the get-go instead of trying to do it retroactively.
I mean, so you've clearly highlighted that obviously the health plan patient and the health plan provider relationships are both very important to ensure that.
Yes, absolutely.
Is there anything that you would highlight specifically that you would think can be done to improve these relationships, specifically the provider health plan relationship, since you've worked on that side for quite a long time? Is there anything specifically that you think could be done to help that relationship get better and work better?
Yeah, I think so. Having done this now for decades, I think just communication, a lot of providers, whether it's more perception or whether it's actual truth, feel like there's not a lot of feedback. And so I think just opening those channels, having communications, maybe having some sort of regularly scheduled webinar or Zoom meeting, maybe once a quarter or twice a year, where key concern areas are discussed, and maybe payers can provide examples of, look, this is where we feel like things might be going a little off the rails, and then providers can provide feedback. And so I think that communication is important, and then also having things in writing. So having written policies is really beneficial, because then providers can read those. They can read the references. Okay, where's the payer coming from clinically? Why are they suggesting this versus that? So open communication and then written policies, I think, are really helpful.
That's really interesting. And I guess these are some of the messages we try to promote with our event, that communication and, just a good collaboration through that is very important between payers and providers. So as someone who's coming, I guess, from the provider side, what is one aspect of this upcoming event that you are personally excited for?
I'm excited for just the connections with people from across the industry, so both provider and payer, and to hear other perspectives. Right, so we can sometimes get stuck in our lane, if you will, and so hearing the perspective of people and entities that might look at things a little bit differently can go a long way. And so I'm just excited about those interactions with colleagues on both payers and providers, and making those connections.
Mhm. And so what would you say to a payer or a provider who is debating about potentially coming along, but they haven't, quite made up their mind yet?
Yeah, well, so I would say come. I mean, come participate. You don't benefit very much unless you're in the arena, so to speak, right? Yes, you can read things, you can look at presentations and that sort of thing, but unless you're actually sitting down and talking to people, I think that there's a value there. So I would just say come, and let's talk, let's meet. That would be great. I'd love to have other people come.
That sounds great. And I really hope people take you up on that and actually come along. And I hope you can meet a lot of people. And I also really look forward to meeting you there. So see you in Vegas.
Yes, likewise. Come along, everyone.